VCY America presents Crosstalk, a nationwide call-in program discussing issues that have an effect on our families, our communities, our churches, our nation, and our world. Crosstalk, an opportunity for you to voice your concerns for biblical principles. And now live by satellite and around the world on the internet at vcyamerica.org. Here is today's Crosstalk.
And thank you for joining us today here on Crosstalk on the VCY American Network. Ladies and gentlemen, many of us have our eyes on the calendar for November 6th, next week Tuesday. That's the day of our nation's election. But did you know there's another date on the national calendar that is just 10 days after that date? It's a date of great significance, November the 16th. It just happens to be the deadline for state governors across this nation to declare their intentions regarding the implementation of a health insurance exchange under Obamacare. Well, here to discuss this issue today with us is Twila Brase. Twila is president of the Citizens Council for Health Freedom and is a certified public health nurse. She's based in Minnesota, where she's provided testimony at the state legislative level, but she's also met with members of the U.S. Congress and speaks around the country regarding nationalized health care-related issues. The Citizens Council for Health Freedom is an organization that supports patient and doctor freedom, medical innovation, and the right of citizens to a confidential patient-doctor relationship. Twila, thanks for joining us again here today on Crosstalk.
Happy to be here, Jim. Thank you.
If you would, let's begin by explaining. We have this deadline come up, which we'll talk about in a moment, but what is a health insurance exchange?
Well, I like to, when I get that kind of question, I like to say what they say it is and what it really is. So let me just say that what the proponents of it say that it is they say it is a one-stop shop for purchasing health insurance online that the government will set up in every state to make purchasing of health insurance easy for everyone. That's what they say it is. But what we say it is a large national infrastructure, a large national mechanism to register your health insurance for the purposes of the Obamacare mandate to buy health insurance. The exchange connects directly with the IRS. The IRS can look at everybody who has registered, which means everybody who has purchased health insurance will have registered with the federal government that they have actually purchased, and they will do it through this thing called the exchange. And then the IRS can impose penalties on anyone who has not signed up or anyone who doesn't have the right kind of insurance or anyone who hasn't exempted themselves from the mandate according to law. So, it's like the exchange is being sold as though it's just a simple marketplace to purchase health insurance, but we know that it's really a large national government bureaucracy to try and force everyone into the kind of health care, the kind of health insurance that the government wants, and then to penalize anyone who doesn't comply.
Where did this November 16th deadline for states come from? I mean, we have just turned the calendar here into November. Where did this November 16th date come from?
Well, under the Obamacare law, which says that states have to set up these exchanges, these online portals within their state, or the federal government will come and set one up. That's what the law says. And so what the U.S. Department of Health and Human Services is doing is they are trying to drive governors in every state to commit to either setting up the exchange or letting the federal government come in and install one in the state. And so I think it was in May of this year, they issued this deadline and said by November 16th, 10 days after the election, every state is going to have to tell the U.S. Department of Health and Human Services what they should do. But what I'm here to say is that this is an artificial deadline. There's no deadline anywhere in law, not in state law, not in federal law, not in Obamacare, nothing. It's just something that the federal government is trying to do to push governors into committing to comply and to cooperate. And our organization is saying you should not agree to do any such thing, and you are not required under law to do any such thing.
So you're saying a governor, a state, can actually say no?
Absolutely. When you look at Obamacare, what you have to realize is that the federal government, Congress, the Democrat Congress at the time, realized that they could not force any state to actually install this exchange, to build this mechanism to help the federal government impose national health care. They realized that they couldn't do it, and so they have a fallback strategy called a federal exchange. The only reason you have to have a fallback strategy is because you can't make anybody do the first thing that you want them to do, which is to actually build it themselves. But so many states around the country have realized that, you know what, we don't have to do this. And if Obamacare goes away, if the if the election turns a different way, then perhaps this will all be gone anyway. But what I like to say is the law doesn't require any governor to set this thing up. It doesn't require them to cooperate. This is the Achilles heel of Obamacare, the fact that it is so dependent on states to cooperate, and yet what states have to back them up is the 10th Amendment and the states' rights, which says that all powers belong to the states and to individuals that are not specified in the Constitution for the federal government. Well, this isn't specified, so the power to say no is with the states.
Well, Twila, didn't we just find that, though, through the recent Supreme Court decision? I mean, this was a suit that had been launched against the administration by a good number of states across the nation. Didn't the court rule states, you lost out on this? I mean, didn't the court rule against the states?
No, and it's really important to be clear what the court ruled on. It didn't even rule on the whole law. There were really only a few questions, and they were very specific questions. One of the questions was whether the mandate to purchase health insurance is constitutional. And Justice Roberts said it's not constitutional. It's not constitutional. But what he said that the federal government could do was to fine anyone who chooses not to purchase health insurance. And yet it was very clearly in the ruling that you are not doing anything illegal at all if you do not purchase health insurance. It is not constitutional to force you. The other thing, it's just that you would be doing something illegal if you didn't pay this new fine for not purchasing, but you are perfectly within your right not to purchase health insurance. That was very clear in the ruling. The second thing about the ruling is that the states, the 26 states who filed against the federal government, were being told by the federal government that they had to expand Medicaid, or they would lose all their current Medicaid dollars. Medicaid is a program that is half funded by the state and half funded by the federal government, so there's a lot of money to be lost. And it's not exactly half and half, but that's just, for your listeners to understand. There's two main funders here, federal and state. And but what the Supreme Court ruled was that the federal government could not commandeer the states and force them to expand Medicaid under this threat of taking away their dollars. They couldn't do it. So the Supreme Court ruled for the states and said the federal government can't commandeer. Well, this is the same thing with the exchange. The federal government can't commandeer the states and force them to install this mechanism. And the law itself, as I said, has a fallback, which says that the federal government can build a federal exchange and then can try to operate it in the states. But what if the states don't even offer them all the data on people in order to make this happen? And what if the U.S. House continues to refuse to fund the federal exchange? Because what you have to understand is President Obama and the team who put this bill together, they thought that states would just roll over and build this exchange themselves. They thought that states would build this portal, this online website that would hook into the big national exchange and share all this data, and that states would be willing to spend the $10 to $100 million a year to run this thing. But states said, I don't think so. There's only 13 states that have declared that they are going to do this. So what we're trying to say is states have the power to say no, and when they say no to the implementation of Obamacare.
Twila, I have heard it said by activists, legislators, and groups saying, hey, we need to do this as a state because if we don't put in the state exchange, then we default to the federal government's exchange, and we would rather be in control and have the say-so in our own state exchange rather than default to the federal government. What's your response?
Well, that is a short-sighted understanding of really what the law says. Every exchange is a federal exchange. Every exchange has to follow the federal law. Every exchange has to follow the federal regulations. There's no difference between whether a state does it or the federal government does it. The federal government is in full control at all levels, all angles. The federal government might give you a little say-so in that if you're in Pennsylvania, they'll allow you to call it the Pennsylvania Exchange. But the Pennsylvania Exchange has to do exactly what the Wisconsin Exchange has to do exactly what the California Exchange does. They all have to follow the same rules, the same law. This is like one of those empty threats out there trying to get the states to think that they have some control, where the whole time they will have none whatsoever. In fact, they have to report every year to the Secretary of HHS and on any data that the Secretary wants from them. Every exchange is a federal exchange. It's just a matter of whether it looks more like a state one or it looks more like a federal one, but they're all under federal control. And even worse, for states who decide to put this in, states will have to fund the $10 to $100 million a year in operating costs, which of course means taxpayers, or they might increase your premiums in order to cover the costs. And above and beyond that, there's a serious threat for employers. So if an employer's employee goes to a state-run exchange and buys health insurance and gets a premium subsidy, that employer can be fined up to $3,000 per employee. If there's no state-run exchange, there's no fine. So there are so many things states should be about how much control they don't have and how much control they will keep if they simply refuse to say no. Simply refuse and say no.
Well, no wonder why we've got, 16,000 IRS agents
Yes.
to be hired for the implementation of this.
Right.
So if a state says no to this, the money then is not coming from the state treasury, so to speak. Does this default those expenses into the federal government? I mean, how could the federal government even sustain that?
Well, here's the interesting thing, because the federal government did not appropriate any money for themselves in Obamacare to build a federal exchange, because they just thought the states would up and do this.
So this could collapse under its own weight?
Totally collapse, and we would hope that it will. And furthermore, I heard a legislator recently say, now exactly how would this work? How would the federal government come in here and impose an exchange? I mean, how would that work? What would they be hoping that we would do to help them, right? So, how would that happen? What if the state said, okay, you can try, but we're not lifting a finger. We're not giving you money. We're not paying any fees. We're not giving you any data on anybody in the states who even know who's here. The whole thing can collapse on its own as long as the states refuse to cooperate. So, the November 16th deadline, that whole thing is just meant to get the governors and the legislators to take one step forward towards commitment. And we say no state should take any steps forward for commitment, for cooperation, for compliance, nothing.
Twila Brase is with us here today on Crosstalk. We're going to come back and talk about the contrast between this government-run exchange versus a private health insurance exchange. Also, what is it that the citizens of this nation can do regarding the implementation of these state exchanges? Do you have a voice? Find out as you stay tuned to Crosstalk here on VCY America.
Back to Genesis with Dr. John Morris, geologist and president of the Institute for Creation Research. Dr. Morris, did humans and dinosaurs ever live at the same time?
Yes, indeed they did, Chris, according to the Bible. On day 6 of Creation Week, the land animals, including the dinosaurs and man, were created. They lived at the same time. Now, this doesn't mean they lived at the same place. Dinosaurs were very likely swamp dwellers, and humans don't usually live in swamps. No doubt they encountered one another, but this was probably sporadic. Even after the flood, there's a great deal of evidence that dinosaurs and man lived at the same time. For instance, the legends of humans encountering great dragons, which are best understood as the faded memories of human encounters with dinosaurs. Also, there's quite a number of rock drawings and artifacts that indicate that humans knew about these beasts. At least that's the way I see it from a Back to Genesis perspective.
Thanks, Dr. Morris. For more on creation, visit our website at www.icr.org.
Folks, November 16th is just around the corner, the deadline for state governors to declare their intentions regarding the implementation of a health insurance exchange. We're speaking today with Twila Brase, the president of the Citizens Council for Health Freedom. And Twila, before we get back into our discussion, give out your website information, because I can tell by our conversation we are just going to nick the surface here on the important issues, but you've got a wealth of information on your website where people can go to.
Yes, it's www.cchfreedom.org, cchfreedom.org. And when they're there, we hope that they will sign up for our e-news, which is right at the top of the homepage there, and it'll come out weekly and give them, well, what we consider is news that they aren't going to hear anywhere else, of really interesting things, not just about this kind of policy, but also about euthanasia or the EPA doing research on people who are unhealthy, and all sorts of information that people will probably find of great interest.
Twila, last week, your organization had released a report on private health insurance exchanges versus government-run exchanges. Could you just give us an overall bird's-eye view of a comparison and contrast between these two models?
Yes. So a private health insurance exchange is exactly what it says it is. In other words, it's a place to go online where you look at all the different types of health insurance policies that are possible, and the whole purpose there is simply to purchase health insurance. There's nobody trying to figure out whether you're insured or not, or limiting what kind of policies can be had, or telling you what kind of benefits you have to have. It's simply a marketplace, an online marketplace for the purchase of health insurance, either for the employer or for the individual. And we really think a lot of employers who want to use this are simply going to give their people dollars and tell them to go onto the exchange and pick whatever policy works for their family and purchase it right then and there. It has nothing to do with the government. It has nothing to do with the Obama exchanges, which are all about a tracking system that I talked about earlier. This is all really about just a new way, an online way to purchase health insurance.
Okay, and since your organization is one that's an advocate of patient privacy, are you finding that the government-run program, how does that compare in privacy versus the private model?
Well, the private model, it's whoever is running the exchange. So the private exchanges are being built across the country, and they're being built by companies. They're being built by insurance companies who want to sell just their own products. There are entrepreneurs who are taking lots of insurance products from all over the place and putting them in one place. And so whoever runs it is obviously going to have that kind of information, and that will be part of a contract between the individual who purchases and the exchange, which is the place where they're going online to purchase, as well as whoever the company is that they're buying the health insurance from. It all becomes a private contract, whereas the public exchange, which is really more of a tracking and enforcement system, that's all about the government gathering data and checking off who is and is not insured, and who the IRS can go after to pay the penalty for choosing to be uninsured.
Does this also give them access to medical records?
The private health insurance exchanges should not be giving them access to medical records unless there's some need for underwriting. Now, under current underwriting is where you look at somebody's medical history and you decide how much they need to pay for their health insurance policy, or whether they're going to be denied. Under current law, under Obamacare, there's no underwriting law allowed. And there's very few people, relatively speaking, that actually have to deal with this, particularly because a lot of people are within their employer groups, and so there's no underwriting there as well. We don't actually know what the future could be as these things really get up and running, but there is a whole lot of activity taking place right now to build them in the private sector as opposed to the public.
Mm-hmm. Twila, how does our election next week impact this whole matter?
Well, when we look at the election, we think that if President Obama is reelected, it's critical for the states to stand up and say no to helping him implement Obamacare, because all the power is in the states. All the states have to do is stand up and say no, and it will be very difficult for President Obama to make this thing happen. Now, if Governor Romney gets elected, the important thing to understand is the law is still the law. And so until the agencies, the departments at the federal level start to do something significant to undo what President Obama has already done, it's still going to move forward. There are still $1.2 billion that has been given to create the exchanges. And in states that are hoping for national health care and hoping to help President Obama move in that direction, or the next president who wants it move it in that direction, they will try to build as much as they can. So what's really important to understand is that while we would like Governor Romney to do everything possible to start to shut it down, it still remains the law, and it will be a process to undo it. We would like to see him and his staff and his agencies start to move immediately to repeal it, to look at how to rescind all the 13,000 pages of rules that have come out. That's what we would like to see. But the important thing to understand is it's the law right now, and so resistance is going to be the biggest thing needed no matter who gets elected.
Do the governors across this nation know that they have that power, that authority to say no?
Sometimes I wonder. And I wonder about legislators, too, because so many times I hear state legislators who just say things like, well, the federal government says we have to. And I think, you took an oath of office. Did you read what those documents say that you are going to be defending? And so I just think there's perhaps in general a lack of literacy about the 10th Amendment, about what states can do against the federal government when the federal government tries to encroach beyond its constitutional limits. And, we were happy to see those 26 states file a lawsuit against the Obama administration and win when it came to the encroachment having to do with Medicaid. But this should be a sign to all of those governors and all of those states that this is the same thing that can happen, and you don't need a lawsuit. You just have to stand up and refuse to cooperate.
Okay, so this really begs the next question then. What can the average citizen that's listening to this program right now do in regard to this issue?
Well, the average citizen should simply pick up their phone, and as soon as the election is over, they can certainly ask the candidates right now, where are you on this issue, and try and peg them down before the election takes place, if they can reach them or if they're at an event with them, and let them know that they don't have to put in this main infrastructure that will bring national health care to this country state by state. But after the election is done, what they should be doing is they should be calling the governor and calling legislators and saying, did you know about the November 16th deadline? I want you to refuse to send any kind of letter whatsoever. Or you can you can send a letter that says, we refuse to respond to this request to make a decision. We will not be making a decision. Or we will not be cooperating in the implementation of the exchange or any part of national health care. So, I think that's probably the strongest thing that an individual can do. And then, of course, they can work with their legislators as they move into the next legislative session on bills that actually say, we're not complying.
Twila, as I observe this election coming up next Tuesday, there's only a portion of the states whose governors are up for election. There's a great number of states where the governor is going to be staying in place for another couple of years. So, therefore, wouldn't it behoove even in those states and the new governors who would be coming in aren't going to take their oath of office until January, I'm guessing.
Right.
So wouldn't it behoove people, even regarding who is that governor, whether they're up for election or not, to make those calls even today or this week to the sitting governor?
Yes, absolutely. I'm sorry, I did forget about that. That's right, because the governor of today is the governor of, for sure, the next several months, depending on how the state does it. And so it is the governor of today that will make the decision and can tell their own administration to not move forward on responding to this demand by HHS to make a decision to commit.
So they could simply say, do not install a state-run health exchange for Obamacare.
Right, and they can say they can tell their governor, if you're going to write a letter for November 16th, write that letter to say we will not comply with any implementation of any kind of exchange in our state. Or they can tell the governor, do not respond to that request. Do not commit in any way to anything.
Though some of you are listening to, I have no idea how to get a hold of my governor. Folks, just go on your computer and put in your state name and followed by the word governor, like Wisconsin governor, Illinois governor, Montana governor, and you put that into a search engine, and I can guarantee you're going to find out a phone number contact. You're going to find an email address for your governor to communicate with him directly regarding this issue. They're facing this, and there is a lot of pressure going upon governors across the nation now to implement this state, or to let the federal government know of their desire or their intent to establish a state-run health exchange. And a lot of pressure is coming their way, and they need to hear from people across this nation, common, ordinary people like you and I, to take a stand as far as the implementation, to take a stand against implementing that which the majority of this nation have said no to. Folks, you can get online with your computers to find that information. But Twila, let me also ask you this. If all moves forward with Obamacare as we know it, what changes lie in store for 2013, which is now less than 60 days away?
Well, there are new taxes that will come into play, and nobody will be able to get around those taxes. And there are the exchanges are all supposed to be in place and operating in October 2013 and open for enrollment so that everybody is enrolled by January 1st of 2014. So, and there's a whole passel of things. I mean, it's in, there's 2,700 pages of this bill. And growing. Well,
the policies are growing, I should say.
Right. The regulations are growing. And so there are particularly taxes. I think that's what people are going to feel. But I think the other thing that they're going to feel is there's something that's called an ACO, and that stands for Accountable Care Organization. And some have called the ACO an HMO on steroids. And if you recall how there was a patient bill of rights because of all the terrible things that were happening with the HMOs denying access to care, then you get an idea of what we're looking at as a country as Obamacare tries to move the entire country into something that are called ACOs.
Is that kind of like the death panels we heard about?
Well, the ACOs are actually where all the doctors come under the purview or under the umbrella of the hospital, and then the health plans pay a lump sum payment to the hospital to be divvied out either over the year or maybe even up to over 3 years per individual that is covered within that hospital. So imagine that you are an expensive patient, let's just imagine that you're an expensive patient. The hospital doesn't get paid to take care of you. They get paid to take care of you for a year or 3 years, and they get a lump sum payment. So every time you come in the door, you are taking out of that lump sum payment, and you may not have been paid enough for this expensive patient. And so the expensive patient becomes a burden to the hospital, someone the hospital doesn't want to see and might not spend as much on to take care of them.
Absolutely amazing. Folks, we're going to open our phone lines here. Our number 800-733-9829. Let's take your questions and comments. 800-733-9829. We'll be right back.
A new feature-length film is now available on DVD. Amazing Love is the story about a youth director and his wife who take 5 teens from their youth group to the wilderness for 2 nights to camp out. 2 teen girls have a sharp argument that causes division. Tensions are high. The youth leader gathers all the kids and decides to tell the story of Hosea. Using flashback, the film takes you to Nazareth as the story of Hosea unfolds. It's a story of commitment, of keeping vows before God, of faithfulness and unconditional love. Through November 17th, Crosstalk is making available 1 copy of Amazing Love for a donation of $18, and any additional copies to the same address for a donation of $10 each. 2 copies are available for $28, 3 copies for $38, and so on. The story will impact teens and adults alike. To obtain your copies of Amazing Love, visit vcyamerica.org or call 1-800-729-9829. 1-800-729-9829.
certainly many are concerned about the implementation of Obamacare across the nation, and there is this date of November 16th, a deadline for state governors to declare their intentions regarding implementation of a state-run health insurance exchange that's to be subservient to the federal government. But our guest here today is saying governors say no, states say no to the establishment of such an exchange. What happens then? Well, it defaults to the federal government where there is no money allocated for the establishment of a federal exchange. It could collapse under its own weight, and certainly states can stand up and must stand up to these dictates that are coming down from the federal government. Our guest today is Twila Brase. She is from the Citizens Council for Health Freedom. And Twila, we're going to have you give, if you would, both your website address again. And for those who don't have access, you do have information in hard copy as well, that you can send out to those who request it. So we'll have you give a phone number where our listeners can be in contact with you.
Sure. The website is www.cchfreedom.org, and at the top of that is how you can sign up for our e-news, which comes out weekly, and we have people all over the country signing up for that. And then our phone number is 651-646-8935, and we will send you out the 10 things to know about Obamacare, and then as well we have other publications throughout the year, but I think the 10 things to know about Obamacare would be a very good piece of material for people to know.
Friends, again, that number is 651-646-8935, and ask for that printed information. They'll be glad to get that out to you. One other question before we get to the phone calls, and that is increasingly we're hearing about a number of institutions that are filing lawsuits against Obamacare, against the Health and Human Services mandate. Just hours ago, we heard that there is a press conference that was convening early afternoon today that Criswell College is filing a lawsuit against this, against the mandate. How do these institutions, and there's so many of these that are growing on a regular basis, how does that all relate to the implementation of these exchanges and Obamacare as a whole? Tie those loose ends together for us, if you would.
Sure. The exchanges, you have to think of the exchange as the main mechanism through which Obamacare will be installed throughout the entire country. If they don't have the exchange, they can't do it. So when you look at the mandate to do like contraceptive services or, contraceptives and things that are violations of people's religious freedom or violations of their ethics or whatever else might be in there, you have to understand that the exchanges are the ones who control what kind of health plan people can purchase, what kind of things must be in those health plans that people have to buy, what kind of coverage, and who can actually provide services according to how they are graded by the health plan. So the exchanges really have control over the entire healthcare system if they are allowed to be installed. And this is why this is not just about agreeing to put in an exchange or not. It's agreeing to whether they're going to agree to comply to install Obamacare. Because when you install the exchange, you install Obamacare.
Let's go to the phone lines, which are packed, by the way. We're going to begin in West Dallas. Beth, you're on the air.
Yes, I just got off the phone with Governor Scott Walker's office, and she said that no, Governor Walker is not complying with the Barack Obama, deadline. In fact, she told me that he knows that the November 16th date is not legitimate. So I just wanted to pass that on. And if people want to call and just say that they're against these exchanges, that might be good reinforcement. But he's already on board with not complying, and he already knows that this is a bogus date, this November 16th.
And, Beth, I am confident that he is getting a lot of pressure, though, to go ahead and implement it, so support for his position would probably be in good order as well.
Correct. Yes.
Thank you, Beth.
Sure.
Christina in Iron Mountain, Michigan, you're on the air.
Well, good afternoon. My husband and I were watching YouTube, and we just YouTubed Obamacare and the RFID chips, and I was wondering if you could touch on, some of the language that is actually in the bill about it, with being able to determine a person's financial status prior to seeing a physician, or they could turn you away if, your bank account doesn't have...
Okay. Twila, is there anything in the legislation that deals with RFID? I've seen different emails surface on this that Obamacare mandates the implementation of a RFID chip in people all across the nation. What is truth? What is fiction?
Well, I've looked at the bill, and I have seen this, and there was more concern in the original 3200, HR 3200. But what this bill has is it does have RFID, but in medical devices. So only in medical devices. I mean, the emails that I have seen come over talking about everybody's going to get a chip placed in them, it is in medical devices, and we would like it to also, we don't like that because why should you have an RFID chip in your medical device if you don't want one in your medical device? For instance,
like a pacemaker or something like that?
Right, like a pacemaker, like a spinal fusion, a piece for spinal fusion, anything you can think of that would be a medical device that would be inserted, and it creates a registry of all the medical devices.
Knee replacement?
Right, there's a few different classes, right, like class 2, class 3.
Right, and so there are people who won't like this, and there are people who will like this. But we don't like the mandate that, no matter what, there has to be this identifier if you get a medical device. It's more expensive. It's tracking. You may not want to be tracked. You may be willing to have the risk of not being notified.
Okay, so what about the financial aspect of it, being able to determine whether they're going to be able to afford the service?
I don't see that in there now.
It's I have the bill. I have all the pages printed off. It's HR 3962. We're talking about, right?
Right.
Page 77 and 78.
And it might be an interpretation of it. They definitely want to know about your finances, but I don't believe it's an RFID chip.
Okay.
It is. There are different ways that they want to try and figure that out, but I have not seen that. I have not looked at that and thought that was an RFID chip.
Christine, I appreciate the call, and if you have further, so we don't go too far in one area, if you want to follow up further with them at this number, 651-646-8935 to Citizens Council for Health Freedom to take that issue further if you need to.
Okay, great. Thank you.
Thanks for the call.
Bye-bye.
Let's go to Sandy, who's calling from Minnesota. You're on the air, Sandy.
Hi, thank you for taking my call. First of all, it doesn't surprise me that Scott Walker would be against it, but in Minnesota, I would be very, very nervous that our governor would go with it.
Twila's from Minnesota. What's the status there in your state, Twila?
Our governor has executive ordered the exchange and has just accepted an additional $42.5 million to design and develop it, but he has no legislative authority to turn it on or to use one dime of state money. And so this is why when it comes to the upcoming election, it will be very interesting to find out whether or not he still has a Republican legislature which will say no to him and stop him in his tracks, or whether he has a Democrat legislature which will help him to actually build it here. So there are things happening in Minnesota that are moving forward, but there are also things we've stopped it 3 different years now. And so he had to executive order it, but he is limited in what he can do under that executive order.
Well, that's good to hear. He'll still get my call. But then on the part that you were talking about, if the patient takes up too much care, they're not going to be happy with this. The hospitals won't be. But it just seems to me like the seniors are really going to take a big hit on this, and it's certainly going to bring put euthanasia on the increase, I would think.
Well, anytime that there is an incentive to ration care, the law says that one of those so-called death panels that they can't ration care, but they can limit what gets paid for. And so, now we come into semantics as to what does it actually mean to ration care. Is the doctor or the hospital going to be forever giving out care that they don't get paid for? No, of course they can't, which is one of the reasons why we say that the entire healthcare system has to turn itself over into something where individuals are the ones who control the dollars. Right now, most people are beholden to their health insurance plan or to Medicaid or to Medicare, and they hold all the dollars, and the patients have nothing to say about it. And whatever happens politically, whatever happens corporately, you can beg, borrow, and steal, as it were, to try and get the care that you need. But like for Medicare, if Medicare says no to a certain service and you say, well, I will pay cash for it, that is illegal for the doctor or the hospital to take your money. And so we have moved into a time where it will be very easy for the hospitals and the doctors to ration care because you can't even pay for the care that you want. And they're not going to tell you that they could give you something because then we get into a situation where lawsuits start. Mm-hmm. So it's a dangerous time, I think, for patients and a difficult time for doctors, and it's really time for a lot of doctors to get out of the insurance business, start taking cash, and it's time for patients to start saving their money. And then once that happens, as it has happened in Oklahoma and Tennessee where there are cash-only places, the prices come down astronomically, and they become something that the pocketbook can bear. And so there is hope here, but it is not staying in this current system where they're offering health security but giving you nothing but rationing.
Sandy, thanks for your call. Let's go to South Dakota next. Sam, thanks for calling Crosstalk. You're on the air with Twila Brase.
Yes, I just got on the show a little late, and I got a few questions that I've been wanting to ask a long time already. If, as an individual, when Obamacare takes effect, and I don't have any insurance for my family, do I have to go on this program, or don't I have to go on the program if I already have insurance? And then the other question I have is, do you offer information where I can get a helpline? I'll hang up now and
information where you can get what?
Health insurance.
Oh, I see. Okay, so in answer to that whole group of questions, the Obamacare requires that everyone except those who are considered exempt have health insurance or pay a penalty. And you may or may not fit under one of the 8 exemptions, and I believe that we have a paper on our website showing what those 8 exemptions are, and if not, you can give a call or send an email right from our website. And but otherwise, you do have to pay a fine to the IRS for choosing to be uninsured. And if you're looking for health insurance options, Obamacare is going to greatly increase the cost of health insurance. I just read one report that said in one state, I can't remember what state it was, but the single coverage for the individual could go up as high as 85% increase.
Oh, my.
Yes. So it's going to be more difficult for people to purchase health insurance and easier for them to pay the fine. And so I think that's what we're going to see a lot taking place. As far as insurance options, it's all about your state. Most states actually provide for you all the different options on a government website, or you can even choose a health sharing organization, and we have information about that. That is one of the exemptions, a health sharing organization like MediShare or Samaritan Ministries.
Okay, and folks, we'll give you contact here for our guest, and we'll take more phone calls after the break. You're listening to Crosstalk here on VCY America.
For the Worldview Weekend Minute, I'm Brandon House. Our website is worldviewweekend.com. You hear the term sometimes, Reconstructionism, or he's a Reconstructionist. What does that mean? Dr. Tommy Ice defines Reconstructionism as the belief that God will bless the church's efforts to Christianize the earth. Since God's kingdom was established at Christ's first coming, godly dominion will be mediated through the church before the return of Christ. That's what they teach. That the victory of God's kingdom on earth will be enduring and continuous with this present era. Dr. Tommy Ice and I both disagree with Reconstructionism or Reconstructionists. We believe that we don't build God's kingdom here on earth now. We build it in the spiritual realm as we preach the gospel. Jesus said in John 18:36, "My kingdom is not of this world, it is not from here." While many of the Reconstructionists oppose the New Apostolic Reformation with its dominion theology of prophets and apostles, we still, at least I, still disagree with the idea of Reconstructionism.
Twila Brase is the president of the Citizens Council for Health Freedom. Again, the website, folks, where you can download information, cchfreedom.org, cchfreedom.org. They do have hard copies of information that they can send you as well, or answer other specific questions. Their phone number is area code 651-646-8935, 651-646-8935. Our lines are packed. Let's see, holding the longest is John in West Milwaukee. John, you're on the air.
Yeah, I heard something that you mentioned there that kind of floored me a little bit when you mentioned that the IRS is going to be involved to ensure compliance.
Yes.
Wow.
The IRS, actually every exchange, every state-based, state-run, state-funded exchange has to be connected through information technology online to a federal data services hub. That federal data services hub sends information directly to the IRS, to the HHS, to the Social Security Administration, to the Department of Justice, to Treasury. All of these finding out information, tracking different information, and the IRS will use this as an enforcement tool to fine anybody who chooses not to comply with the mandate to purchase health insurance, or to fine an employer whose employee chooses to buy health insurance on the exchange rather than through the employer. The IRS is huge, huge. I once heard that 700 pages of the 2,700-page bill are all a rewrite of IRS code to make this huge data exchange happen.
Okay, well, thanks for clearing that up for me.
Yes.
Yeah, sorry to unsettle your lunch there. To Franklin, Bruce, you're on the air.
Oh, yes, I just read an article from thenewamerican.com today, and they're saying that there's 3 different state legislators that are bringing up bills to nullify Obamacare, and that perhaps those citizens should encourage their Congress people to vote against it.
Okay, thank you, Bruce. And no doubt, lame duck session coming up here in just near future after the election. Right. By the way, folks, you can contact your governors. They're facing this date of November 16th to declare their intentions on this. And Twila, in a simple sentence, what can people say to their governor?
They can tell their governor to refuse to comply or cooperate with this demand for a decision, not to send any response whatsoever unless the response is, we just say no.
To the battleground state of Ohio, John, you're on the air.
Yes, I have a thought on on what the actual amount is. I read somewhere, it seemed like in about the last 6 months or maybe even 3 months, it looks like it's going to be like about $1,200 a year, and they're going to actually take it out and deal with it when people file their basic IRS taxes on the April 15th.
You're referring to the fine, John?
Yes.
Okay. And Twila, what do you know about those numbers?
Yes, the fine, the highest the fine goes up to 2% of your income. And so it's going to be very low. For some people, they're going to find it, $95 for the year. The interesting thing about the fine is because they didn't write in law that the IRS could actually put you in jail for not paying it. So there is some thought that what the IRS will do when you pay your taxes is they will take out the fine first, and then whatever is left, that is your actual taxes to be paid, then they can come after you and jail you if you don't pay them.
So, Twila, if somebody says, "Oh, great, I won't get health insurance. I'll just pay the fine of the $95 or $150, whatever it might be, and I got free health insurance for the year."
They won't have free health insurance, but what they will have is that they will be able to go anytime they want, essentially, and sign up for health insurance and have it covered, which is one of the reasons why the health plan said if they don't enforce the mandate and require everyone to buy health insurance, it'll kill the insurance industry because all of these people will come only when they're sick and not pay when they aren't. Mm-hmm. So it won't actually act as insurance. So this is, hopefully Obamacare will be repealed and we won't have to deal with it. But the fact of the matter is it will be much less expensive for people to simply pay the fine and then wait until they get sick and then buy insurance.
Thank you, John. To Jenny in Theodore, Alabama, you're on the air.
Yes, I just wanted to tell you thank you for your program. And Twila, you are a woman that God has answered our prayer, because if I understood you correctly, if all of the governors and all of the states refuse this date of November 16th and the whole thing comes crashing down, we've in effect taken care of it. Is that correct?
Well, we have taken care of one step of it. As long as they continue to refuse to lift a finger to help implement the exchange, then we take care of it until we get the law repealed. The law sits there for some governor who's in support of it to move forward, right? So we really do need a repeal of the law, but the governors have so much power to just stop it in its tracks until we get the repeal.
Excellent. Well, thank you very much for all of the information. And it's the 2,700 pages. It's like a dog chasing its tail, don't you think?
Yeah. Thank you so much, Jenny. To Pasco, Washington. Marv, you're on the air. Hello, Marv.
Are you talking to me, Mary?
Is this Marv?
No, it's Mary.
Oh, I'm sorry. Mary, go ahead.
Yeah, I had a question because I'm confused. I don't really understand the Obamacare. I don't know if it's going to be the employer that's going to be fined and jailed, or is it going to be the individual? Because my daughters, they don't have medical insurance, and they do have
Okay, we're going to, sorry for interrupting you, but we're less than a minute left on the program, so Twila, go ahead and respond.
There are fines for both, so employers who choose not to provide insurance for their employees, if they have more than 50 employees, those employers will be fined. For individuals who choose not to purchase health insurance, they will be fined. If, on the other hand, you get health insurance through your employer, you will not be fined. So there are fines for both individuals and employers depending on the circumstances.
We have many more people who would want to ask questions. We've run out of time on the program, though. Let me ask you again, Twila, if you would give a website and then give us a phone number as well where our listeners can obtain more information on these issues.
Yes. Our website is cchfreedom.org, and you can sign up for the e-news right at the very top of the home page. Just click and send. And then our phone number is 651-646-8935.
Twila, thanks for being with us here and informing our listeners on this vital, important issue.
Thanks so much, Jim.
Twila Brase has been our guest here today on Crosstalk. Again, that's cchfreedom.org. You can give them a call there as well. November 16th, just around the corner. Governors are making decisions. They need to hear from you with your views on the matter. Thanks for joining us on Crosstalk.
You've been listening to Crosstalk via satellite and the internet from VCY America. Views expressed may or may not be those of this station. For a CD of today's program, send a donation of $6 or more to VCY Tape Ministry, 3434 West Kilbourne Avenue, Milwaukee, Wisconsin, 53208. Or download by RSS or podcast from crosstalkamerica.com. And join us again for Crosstalk.